Hi, everybody. My name's Pam Davis, also known as Barry Bell on Twitter and Facebook. And welcome to the story of me, my weight loss journey. Today is March 2nd, 2018. This is the 17-year surgiversary, as some would call it, of my Roux-en-Y gastric bypass surgery. And what I'm going to do today in this video is I'm going to go through my weight loss journey. And I was very honored to be asked to be the keynote speaker for integrated health at the 2017 Bariatric Summit. And I gave the presentation or the speech that I'm about to record for you guys. I was already really nervous about doing it. It's the first time I've ever been asked to do a keynote address. And the whole way to Savannah, I thought that I was just speaking to other integrated health professionals. And when I got there and I actually started looking at the agenda, I realized quickly that I was actually presenting to both integrated health and to surgeons. So that upped my anxiety just a wee bit. My husband was with me and he sat with me in the front row, and I did my presentation. And much to my surprise, at the end, I got a standing ovation. And I actually had some of the surgeons in the room come up and share their feedback with me after. One in particular, his wife is a bariatric surgery patient. And he said that she had shared many of the same experiences with him over time that I shared that day. Several of my integrated health friends who were there had asked me to consider recording it and having it out there so other patients could see it. So here it is. There are times that I will be glancing down at my notes to make sure that I don't miss anything. But I'm going to give my disclaimer just as I gave the day that I was presenting it. This is my journey, so there's nothing right or wrong about it. If you are not someone who is empathetic to the plight of those affected by obesity, I don't want to hear your snark, hateful, trolly shit. So you can just turn this off now and not watch it. If there's anybody out there who feels the need to criticize this, again, it's my life and my journey. Feel free to, take a pass and move on, because trust me, there's no criticism that you could give that's going to be more critical than I am of myself. So here we go. I'm really honored to actually be sharing this with you guys. So after those disclaimers, just know that the reason I'm doing this is because I'm 52 years old. I have been a nurse for 25 years. I've been affected by obesity for as long as I can ever remember in my life. And I'm hoping that someone else out there who is affected by obesity and they're thinking about having treatment, or they've undergone treatment and they're struggling, will see this and realize that they're not alone. And that's it. So we know that words matter. We know that how people talk about us matters. And as healthcare professionals, we know that words matter. There's still a pervasive bias against those that are affected by obesity. And we know that each of our patients, and I know that each of you, have your own journey and your own story. And as healthcare professionals, we've heard countless stories. And sometimes, while the patient is talking, as a healthcare provider, you may find yourself thinking, yes, yes, I know your doctor told you that you're going to die in 6 months if you don't have this treatment. I understand. I have, seen 12 other patients this week that their doctor has told them the same thing. And you may be kind of jumping on to like what you want to say next as opposed to actually listening to the patient. So I'm just saying, listen to the patient. I've been a bariatric patient since 2001. I've been working in bariatrics since 2004. I have been extremely fortunate to serve in multiple roles within both the American Society for Metabolic and Bariatric Surgery and the Obesity Action Coalition. I also serve on a patient advisory council as part of a disease experience expert panel. And it's actually in this role where they asked each of us on the panel to use a tool that they've provided for us to help us document our patient journey. And that was really the first time that I had really like looked at key experiences in my life that had impacted and influenced my weight, both positively and negatively. So there were 7 of us in this group, and we presented our journeys to a group of obesity researchers and patient advocates. It was a small group, a safe group, but we still had a lot of nerves going into the delivery of our presentations. Um, so I'm an only child. I grew up on a farm in Kentucky. Go Cats! We did have neighbors, but their kids were quite a bit older than I was, so I didn't play with a whole lot of others. And that's one reason the first day of school held so much appeal and intrigue for me. Also, as a result of not really having a lot of other kids to play with those first few years, I didn't really know that I was fat until the first day of first grade. And I was so excited to be there, so, thrilled to see my school and to see, other kids to like make friends with and play with. And the first day of first grade, cutest little blonde haired, blue eyed boy in the world walks up to me and says, "Good morning, Chup Chup." And he proceeded to greet me that way for the next 12 years. So, believe it or not, we're actually now friends on Facebook. Um, but if you're one of my Facebook friends, then feel free to post about this fabulous video that you saw and you heard today where Hunky, which was his nickname for 12 years, picked on Chub Chub, which was his nickname for me for 12 years. You can also feel free to comment about what a total ass he was, if you feel like it. So I tried all of the usual things on elementary school to get out of going to school. I feel bad, my stomach hurts, my head hurts. It never worked, ever. It was always, get up and go, you've got to go to school. So there I was, along with, a couple of others. Always picked last for kickball, always picked last for dodgeball. And of course, always the first one out of dodgeball because, I was an easy target. Um, then, 7th grade, I had lost a little bit of weight, but, not a lot, but you get that growth spurt. So you kind of, for us girls, around 7th, 8th grade, we grow really, get our height really quick, but so that way we slim up a little bit until the weight catches up again. So in 7th grade, I had my first boyfriend, Robbie, for 2 whole hours. All the other guys made fun of him for dating me because of my weight that he broke up with me just a couple hours later. And I mean, I was devastated as, middle school and your first boyfriend that you really, really liked, that you liked. Anyway, my mother was a very, very critical woman. At the end of school year, every summer, she would put me on a diet. So you'll be a whole new person when school starts back in the fall. So what's the underlying message there? There's something wrong with the person that you are now, the fat one. At this point, I still lived on a farm, and one of those summers while on a diet and just being so incredibly hungry, just ravenous hungry. We went to town to the grocery store, so Houchins Market there in Horse Cave, Kentucky, and I grabbed a jar of Jif off the shelf. And I went and I was hiding in the corner, just scooping peanut butter with my fingers out of that jar as fast as I could because I was so hungry and I was trying to relieve that hunger. And, I often laugh now and say that I'm pretty sure that I'm the reason there's those full linings on the inside of the jars of peanut butter because of me leaving that jar in the grocery store and someone else buying my jar of peanut butter. And, so as a result, peanut butter has always been my comfort food, always. So while I may go months without actually eating any peanut butter, there's always at least 3 to 5 jars of different like types and variety in our pantry at all times. Um, this was also around the same time that one of those mini diets my mother would put me on was the grapefruit juice diet, where she would make me hold, or I would have to hold my nose because otherwise I would gag and throw it up. So I'd hold my nose and drink the grapefruit juice before a meal because it was supposed to burn off all the calories that you were going to eat then. I still to this day despise grapefruit juice. I don't even want like a lotion that's got a grapefruit scent in it because it's just nasty. So fast forward a little bit to my sophomore year of high school. I had worked really hard that summer and I had lost some weight and I had this cute little pink terry cloth shorts outfit on and was hanging out with my friends. And I thought I was just like, really looking good and felt so good because I'd lost this weight. And we were hanging out in the Pizza Hut parking lot because when you live in rural Kentucky, there's nowhere else to hang out but the Pizza Hut parking lot. And one of the boys, who was a senior, came out, and I don't even remember really what started it, but he called me a fat bitch in front of about 10 to 15 of our, friends. And what was my response? I reared my hand back and I just hauled off and slugged him, which felt really good at the time. But then to add insult to injury, me and my mother had to go the next day to his house, and I had to apologize to him for slugging him. Um, so, yeah. But unlike the Chub Chub guy, needless to say, he and I are not friends on Facebook. So I got married at 19 years old, and my hubby was actually with me at the bariatric summit, sitting in the front row, supporting me 100%, as he always has. Um, when it comes to supportive people and husbands, he's a rock star at that. He really is. I have 2 children and 2 boys, adults. And with both pregnancies, I gained a lot of weight. My first pregnancy, I gained 72 pounds. I could sit at one meal and think about what I wanted for the next. Morning sickness was not even an option. With my second pregnancy, I gained 34 pounds. And all I can say is, thank goodness for morning sickness during that second one. My hubby, has always said, I love you. I don't care what you weigh. I married you, not a clothing size. And, I had always kind of had the mindset that I wasn't really going to worry about my weight until it started affecting my health. Well, by the time I was 35 years old, I had high blood pressure, was on 3 medications for it, and it was really not well controlled. I had reflux and I had joint pain. I mean, I actually went like couple of years and hardly ever went upstairs in the house. It just hurt too bad to walk up and down the steps. So at 35 years old, I had laparoscopic Roux-en-Y gastric bypass. I was my surgeon's second patient. So I know that you are thinking, wow, she's crazy and or brave. Especially you healthcare professionals are thinking that. But I had a rationale being a nurse and knowing that for the first 10 cases, he was going to be proctored. So I knew I'd rather be 1 through 10 than 11 through 20. And, as I had already mentioned, my mother was not really supportive and she was a bit critical in nature. So I did not tell her that I was having surgery since she'd never really been supportive before of my weight loss efforts. And I decided if I was going to do this, I needed to surround myself with support, which is something I would encourage you as well. If you're going to do this, you need to surround yourself with supportive people. Don't be worried about severing relationships that are not positive in your life. You need to toss those people to the curb. Um, so, of course, since I didn't tell her I was having surgery, the first week home from the hospital after surgery, she comes over for a surprise visit. And this is when they still put a drain in, for every surgery. So here I am, I've got my drain and I'm like, look like, I'm really tired and um, just, just had surgery. So she wanted to know what was going on. So I lied and told her I'd had my gallbladder out. Then 3 months later, she was at the emergency room and I went to see her. And at that point, I had lost 75 pounds in 3 months. And she wanted to know what was going on. She thought I had cancer because I'd lost so much weight so quick. And I told her I'd had weight loss surgery. And her response was, oh, so without saying it, the rest of the sentence that I heard was, you took the easy way out. Don't let anybody ever tell you that surgery is never the easy way out. I've got a whole nother video we'll talk about on that one. So then, after 6 months and losing around 100 pounds, this is a cuter story. I was driving part of my son's soccer team to one of our soccer games. So we were in the van. So here's me and 7 other teenage boys. And my son is sitting in the seat right behind me with his best friend. And his best friend's like, wow, your mom has really lost a lot of weight. My mom's always trying to lose weight. What'd she do? And at the time, Colin was 12 years old, and I have to say he really did a pretty decent job of explaining gastric bypass to his best friend. So I went from 330 pounds to 175 pounds and stayed at that weight for 11 years. I then began traveling more for work and, things like the bariatric summit and, different other things. And I went through a lot of, I guess, I deserve it moments, things where you feel like, well, I've done such and such, so I deserve this grande white mocha from Starbucks. Although it may take me 4 hours to drink it because I'll get dumping syndrome if I drink it too quick. But, you just kind of go through that. That almost trying to rationalize, slipping back into some old habits. So I'll tell you a story. It's a situation that I had driving home from work one day, and I had shared it with another one of the presenters at the summit several years ago, and it's just interesting. So I'm just going to tell you the story. So one day I had a really, really crappy day at work, and I am walking through the parking lot to my car, and I'm like, I'm going to stop at Starbucks today on the way home. It has been a crappy day. I want Starbucks. I deserve Starbucks. I'm going to stop at Starbucks. So then I'm in the car and I'm driving down the road, and I start thinking to myself, what are you doing? You would never let one of your patients get away with this. You would tell them, you're not a dog. Don't reward yourself with food or with any type of calories. You don't deserve any type of caloric treat. You would never let them get away with this. Why do you think you're deserving to get away with it? So then I start bargaining in the car. So first I'm like, well, if the line at the Starbucks drive-through only extends to the parking lot, then I'm going to go. But if it's out into the street, then I'm going to take that as a sign and I'm not going to stop. So I get a little bit further down the road and I'm like, wait, you would not let your patients off with any kind of, bargaining thing like this. So continue the conversation. Finally, I just got all the way over in the far right-hand lane, and I didn't even look at Starbucks as I drove by, and went on home and made my own, 50-calorie version of the coffee that I wanted that was like 450 calories at Starbucks. So I'm telling this to my friend and colleague, and he looks at me with this just incredible look on his face, and he's like, I have never put that much thought into if I was going to Starbucks or not. If I want a coffee and I want to go, I just go. And I said, yes, you do. But now think about that whole scenario I just described to you and how your patients who are trying to work through their obesity have a similar conversation for every meal, every snack, almost every bite of food that they are debating on eating. They have that whole mental conversation back and forth about that. So it's just very, you know, trying to give a very different perspective. So, over time, work had become more and more stressful. And while you have all the normal pressures of work, as the quote face of the program, and everybody knows you're a patient, there's even more pressure. So, I had, so I'm 17 years out from surgery. So I maintained 100% of my weight loss for the first 11 years. And in the last 6 years, so I would actually say after 11 years, there was about that 2 year period where I was traveling a lot that I put on about 30, 35 pounds, and I've put on probably about 15 more since then. So, by anyone's standards, by any surgical standards, by any medical standards, of 160-pound weight loss, I still, 17 years out from surgery, have maintained just over 110 pounds of that weight loss, which means I've maintained more than 50% of my excess weight loss for 17 years. So that means that I am a surgical success. Yet, still, in so many others' eyes, and oftentimes in my eyes, I consider myself a failure because I've not been able to maintain all of that weight loss for all of that period of time. That's why another reason I'm making this video, because I continue to get that reality check from friends and colleagues that work in the bariatric surgery world that have to remind me sometimes that I'm still a surgical success. So I would remind you, each of you, of that as well. But when you work in a program and you're considered the face of the program, and as many times as you remind patients that everybody there is there to help them be successful forever and ever after surgery, sometimes you realize that that seems to apply to everyone but yourself. And after being reminded that part of the reason I was originally hired was because of how I looked, meaning at my lowest post-op weight, that was just a lot of extra added pressure that I didn't need and didn't feel up to facing and dealing with every day, because I want to always be as much of a positive influence and impact as I can on other patients with obesity and other individuals affected by obesity as they're going through their treatment. And so over the last 4 to 5 years, I've regained about a total of 50 pounds. It's not easy. It's not easy to lose that weight again. It's not easy to be the one teaching patients and teaching staff and, doing this video and speaking to you guys when you've regained weight. But I have a couple of messages here. Please, if you're a healthcare provider and you've, watched this video, made it through to the almost 25-minute mark, don't think that you can blame and shame your patients into compliance. That never works for anyone. It does not work. It does not. But for me, what I found is that the busier I stay, the more I keep my mind occupied and my hands occupied, the less time I have to think about food. and the less opportunity I need to soothe myself with food. So on weekends, when I'm away from work, it's really easy to stay kind of focused on doing other things and not eating. Um, I don't mean not eating, period, but not eating other things. Um, so at the time that I was at the bariatric summit, which was back in October, that was when I let them know that I had what I was doing to make myself better, both physically and mentally, is that I have started on one of the weight loss medications. So I take a daily medication that helps me with my appetite. And actually, it kind of helps cravings, all that kind of good stuff. So it's easier to make good choices again when you're not feeling hungry and you're not really craving things. I changed jobs. October was the last day at my previous job, and I've been working from home, doing consulting for several months now. Actually, coming to you live from my home office. See, there's my desk. Whoops, I might tip the phone over, so let me not do that. The rest of the story is, I had to do the emotional work. I had to listen to my husband, who's known all along, damn it, hate it when he's right, that the number on the scale has absolutely nothing whatsoever to do with my worth as an individual, as a human being. And when you go back to work tomorrow, if you're a healthcare professional and you're seeing patients, realize that each and every one of them has a very unique journey that brought them to be in front of you at this point in time. They've had their own perfect storm of factors that has come together to present them to you as somebody that is seeking your help, and they're very deserving of your help. If you're not a healthcare provider and you're watching this and you're, like me, individual affected by obesity, and you're wanting help and support, please reach out to a comprehensive bariatric program. By comprehensive, that can mean a couple of things. It can mean that it offers both medical and surgical weight loss, or it could mean that they have a multidisciplinary program where they have nurses and dietitians and support groups, possibly even psychologists and exercise physiologists that are all there together to help you have the most successful outcome that you can lifelong after surgery, if you choose the surgery route. And please, seek out other sources of support. There are good sources of support on the internet, and there are not so great sources of support on the internet. So choose wisely. But just, reach out to me if you want any other information, or if I can help be supportive of you during your weight loss surgery, during your weight loss journey. Consider reaching out and joining the Obesity Action Coalition if you've not already done so. The nationwide organization, over 50,000 members. We have a convention every year where you can hear from the experts and hang out with hundreds of other patients that are undergoing similar situations as myself, and probably that you have undergone. So welcome. This is my channel. I've got an introduction on there. This is my first video, and I really wanted to record it on my actual surgiversary. So thank you for watching.